Mark, very good to see you. Today, we're going to talk through 4 ways to address long-term care and medical expenses in retirement. According to Fidelity, the average 65-year-old couple will need nearly $315,000 for healthcare in retirement. That's not even including long-term care. Long-term care, meanwhile, 7 out of 10 people will need at some point, and the cost of that not covered by Medicare. So let's talk through our first option here. First is traditional long-term care insurance. What are the pros and cons?
Yeah, traditional long-term care, one of the benefits to it is obviously you're paying a premium to grow an asset that you can use for long-term care. So
Mhm.
essentially, the thinking is, hey, if I pay into this thing and I actually need it, I've got a leverage pool of dollars that I can use tax-free. So that's really the big advantage to that, because again, you're mitigating a big risk in
Right.
retirement. The question is, how sick or unsick are you going to get?
Mhm. Right. And as we were talking about offline, a lot of people don't love it because it's use it or lose it.
Yeah, correct. So, obviously cons are, if I don't need it, it's kind of money down the drain. I
Yeah.
paid for all these premiums along the way, and I'm not going to get anything back from it. And I
Right.
can't typically it's a standalone insurance policy, so premiums aren't guaranteed. They're going to go up. And a lot of people have found if they bought these 20 years ago, they're now having to reduce the benefits to be able to afford the premiums going forward.
Mm. Your next option is asset-based insurance. How does this work?
Yeah, so traditionally in this respect, and I think the good news is the insurance industry really kind of learned from, saying, hey, we're going to issue traditional long-term care standalone policies that we just talked about, but they really took it in the shorts because there were so many people going on benefit. They had to figure out a way to pay for that. So they increased premiums. Well, now what we can do is we can attach a rider in many cases to a life insurance policy. So the chassis is really life insurance. And what we're doing is we're using that death benefit now as a living benefit,
Mm.
pay for long-term care. But I like to call these win-win-win accounts. So we win if we need it because we have leveraged dollars to pay for long-term care.
Right.
We have a premium that doesn't go up. And in fact, we may only have to pay into this. Maybe it's a single pay, a 5 year, but it's a defined payment schedule, not
Mhm.
forever. And then ultimately, yeah, if we need it for long-term care, it's there. If we don't, and we die without using it, it's a death benefit, pays tax-free to our family.
Yeah.
And then most of them, we can get most, if not all, the money back with some interest. So no matter what happens, we win, and we're protecting one of the biggest risks we have in retirement is, again, long-term care and healthcare expenses.
Right. Good point. Our third option would be to self-insure, but this is difficult and risky and kind of goes without saying can be very, very expensive.
Yeah, when you really look at it, I always like to point out this: there are around 38% of women that are over age 65 that are divorced, widowed, or single that are almost living at poverty levels. And a
Oof.
lot of that wasn't because they didn't save enough, it's because they didn't plan this part of retirement. And
Yeah.
a lot of times, we think, hey, the man gets sick first, and if we have to self-insure, we're going to have to drain assets to be able to pay for that. And then what's left for the surviving spouse, and how long are they going to live? So you're right. We've got to be able to create a big cushion if we're going to self-insure, and that can be difficult to do.
Hmm. And then your last option would simply mean becoming a dependent, which is the reality of what happens if you don't have a plan.
Yeah, so I mean, this is again the last option is I have to drain all of my assets and become impoverished to
Right.
basically go on Medicaid. Other than that, I become a dependent of someone else, but most people are going to become a dependent of the state they reside in. And then ultimately, are they going to be able to find a nursing home that's going to take them? Because not all of, I mean, there's not a lot of Medicaid beds
Right.
available. So a
Hmm.
lot of times you'll have to go in and pay out of pocket until that bed or a Medicaid bed becomes available.
Hmm. Right. Which is why proactive planning is key. It's a difficult conversation to have, but if you don't have a plan, this, as you mentioned, could wipe out your retirement savings. So, Mark, if somebody wants to talk through these options with you, what's the best way to reach you?
Yeah, so what they can do is just pick up the phone, give us a call, 303-681-0113. I mean, if it's just a couple of questions that you have, we'll be glad to answer those. If it's something more extensive, we can set up an in-person meeting, meet in our conference room, or ultimately, if you're more comfortable, we can do a Zoom call. The other way, if you want to schedule an appointment or reach us, is through the website, mcgregorwealth.com.
Great. Mark, thank you.
All right. Thank you, Aaron.